don't think we're recording yet. Oh, there's the red dot. Perfect. Sorry about that. This is Emily and Julie, and we're presenting a case study of a 38-year-old female that comes to our clinic today with a chronic history of MS. She has currently been communicating and meeting with her neurologist about some possible medication changes, and she'd like to see us for further clarification. It sounds like we're grateful that we have a better patient rapport and that she feels comfortable talking about these changes, that she has had some suggestions from her neurologist. She's also concerned that she has a sinus infection and needs a Z-Pak today. So we have some chronic concerns that we're going to communicate with our patient, as well as some acute or further exacerbations that we want to detail. So to start, just some baseline of what MS is. MS is an immune system, when the immune system eats away at the protective covering of the nerves and exposes the nerves. This exposure can result in plaques and lesions and various side effects from head to toe. So we're going to see vision changes, balance and gait disturbances, a rigid appearance, and changes with muscle strength. Our patient is 38 years of age, and typically MS is going to have an onset between the 20s to 30s and is more likely to affect women than men. Typically, you see this in greater prevalence in northern populations. That isn't to say that there is a correlation between vitamin D deficiencies and MS, just that this tends to be where more populations are significantly affected. And there are some genetic traits and further monitoring for genetic risk factors across families. Someone may have 1 to 2 plaques and very minimal symptoms. In the case of our 38-year-old female, we're suspicious that maybe this has been a slower onset for her symptoms, or that she has done a really great job of managing her symptoms and the progression of this disease. So as I alluded to, there are some different developments and courses of how MS can come across to patients. So they may have a relapsing remitting type of disease where there are acute on chronic episodes and that the patient stabilizes and gets better, or that there may be a secondary progression or a more gradual deterioration. This I'm suspicious of is the case in our 38-year-old female, where she's had more gradual or slower onset of these symptoms. Type 3 is a primary progressive disease, so a little bit more rapid than the first two types of developments. And finally, the progressive relapsing, where there's a much gradual deterioration from the onset to further relapses. There's no cure for MS, and there's also no definitive test. However, as providers, we want to look at MRI changes as well as CSF analysis. More specifically, we're looking at the signs and symptoms of the patient reporting with 2+ episodes of what we call exacerbations or those lesions, and being able to see those further in their symptoms that they're reporting within progression over a 6-month period. So as I mentioned with the patho, our 38-year-old female may present to our clinic with blurry vision, changes in vision discrepancies, including eye pain or a back of the head headache, some numbness and tingling. She may also have speech changes or swallowing changes. Nerves are all over our body, so head to toe, we're looking at she may have a tremor or paralysis. It may be localized or it may be more in general. The concern we have and should be thinking about as a provider is whether this is more a chronic exacerbation and not just the acute of a sinus infection that she is coming in with today. So our workup needs to include both the acute possibilities of the sinus infection care and treatment, as well as for chronic, knowing that this could be a further exacerbation of the MS. So again, being 38 with MS, we want to listen to her, advise her, and continue to care for her, being mindful of the medication changes, but also the current or acute situation of a possible sinus infection and how that affects the greater picture in being patient-centered. With managing her care and being patient-centered, we are hopeful to advise her further, as Julie's going to tell you, about managing the sinus infection, but also concerned for a worsening infection with this. An infection, whether it's viral or bacterial, can further aggravate that immune system response of the nerves being further exposed and therefore causing further plaques and lesions. So she may, although have more respiratory or sinus-based symptoms right now, that this could result in more balance or vertigo or exacerbation of the MS. All in all, we want to encourage her to have a lifestyle of avoiding stress and changes in extreme temperature. And that we want to consider possibly using a corticosteroid for further flare-up, as well as some form of support group for mental and emotional well-being. Her neurologist mentioned some possible medication changes or additions. And again, there's no cure for MS, similar to no definite diagnosis of it. However, these two medications work by either treating a relapse remission form and further progression of the disease, or to slow the progression. So working on those different receptors, there are certainly benefits to it, but there are also really great risks. And Julie's going to touch a little bit more on those risk factors and further counseling our patients.
Hi, I'm Julie. So the patient is currently on TECFIDERA, which is it's a great treatment choice for MS. However, it's not without some side effects and risks. So one of the things that TECFIDERA can do is decrease your white blood cell count, making, kind of lowering immune response and making people more susceptible to illness. So it's important to take really good care of yourself, avoid people that are sick, wash your hands. And it can also cause liver problems. And, some of the more common side effects include itching, rash, nausea, vomiting, diarrhea, stomach pain, and indigestion, although those are, obviously less severe. So adding Tisarbi to this regimen, things that you'd want to watch out for, a patient would want to call their doctor right away or call their provider right away if they develop herpes zoster or signs of liver damage. And anyway, the most common side effects with that would be headache, urinary tract infection, lung infection, pain in your arms and legs, vaginitis, stomach area pain, feeling tired, joint pain, depression, diarrhea, rash, nose, and throat infections and nausea. The most concerning thing to watch out for is that both of these medications alone would increase your risk of developing something called progressive multifocal leukoencephalopathy, PML, which is very serious and it leads to death or severe disability. Now, both of those have a risk for PML. Taking them together would increase your risk. So I think there would be, as Emily had mentioned, with this 38-year-old woman who's seemingly had a slow progression, we'd really want to consider, quality of life and manifestations of the disease and the progression of her MS to better understand if either switching or adding Tisarbi would, if the benefit outweighs the risk. So in client teaching patient education regarding the sinusitis, so I guess we would first want to gather some more information about her symptoms. As Emily mentioned, having an infection is one of the things that could trigger an MS flare-up, or it could also be indicative that she's already having an MS flare-up, because the sinusitis it's very common in people in having an MS, having exacerbated MS, I guess, or having it kind of flaring up. So we'd want to get a sense of how her symptoms are and how long she's been having them, and to get a sense of if azithromycin would be the best place to start. Another option would be starting with a decongestant such as Sudafed or something over the counter for symptomatic relief, and then monitoring closely. And if her symptoms don't get better or worsen, then we could talk about adding the azithromycin. But some other things to talk about would be, in addition to that decongestant for symptomatic relief, doing some of those lifestyle changes that can help prevent a flare-up, such as avoiding saturated fats, eating omega-3 fatty acids for their anti-inflammatory properties. They can be protective for people, avoiding people who are sick, extreme heat, and stress. So while a Z-Pak is a great choice for sinus infection, and there's no contraindications for taking it along with TECFIDERA or Tisarbi, it may not be the best place to start for her. We'd have to further assess, I guess, how long she's had these sinus symptoms and assess how severe they are, and if they clear up on their own, and if they're responsive to over-the-counter treatments. In addition to, Sudafed, she could take something for pain as well, like Advil, or ibuprofen, which is also has some anti-inflammatory properties. Flonase as well. Those would all be good options for her if her symptoms weren't too severe. Some alternative therapies to consider, things like a neti pot, eucalyptus essential oils, acupuncture, meditation, stress, for stress. What was I going to say? But we would certainly consider azithromycin, depending on, I guess, the severity of her symptoms, and if they seemed like they weren't going to clear, because preventing infections is also really important when you have MS. So patient goals and outcomes. We want to, patient goals from a patient-centered approach. It's really kind of meeting the patient where they're at with their illness. It manifests differently in everyone, and it manifests for people different from day to day, even hour to hour. So, kind of developing a plan based on where they are, and having a plan that's sort of able to shift and change and evolve with the patient. But first and foremost, we want to slow the progression of the physical disability. That can often involve physical therapy to maintain muscle tone, keeping up with activities that they're capable of, decrease the frequency of exacerbations. So while there's no cure for MS, there are those lifestyle changes that people can add to decrease their chances of a relapse, and try to prevent the development of new lesions. And that goes into those things I'd already talked about. Just taking medication as prescribed, and then also those lifestyle changes, things like avoiding getting sick, and then extending the period in between relapses. And the self-care that we mentioned, it's really crucial for that. So conclusions and recap. MS is a disease characterized by the destruction of the myelin sheath surrounding the nerve fibers of the brain, spinal cord, and optic nerve, resulting in impaired nerve impulses. There's no cure for this. It's progressive, but it's possible to slow the progression. And maintaining a quality of life as defined by the patient and what their goals are for their life is central to the treatment. And with this 38-year-old woman, we will discuss the benefits versus the risks of adding Tisarbi, and really assess if this is a good choice for her, and if it's going to be helpful for her with her disease progression, and also address her concerns regarding azithromycin, and really, gather some more information from her, and, see if that would be the best choice for her.
Thank you.
Thanks.
And